Holiday and good afternoon, everyone. Thank you for joining us for today's COVID-19 press conference. At this time, I want to recognize the presence of the Honorable Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam. We also have with us from the Department of Public Health and Social Services, Acting Chief Medical Officer, Dr. Bob Leon Guerrero. We have Fernando Esteves, Incident Commander for the Department of Public Health and Social Services. Joining us virtually, we have Chima Mbakwem, also from the Guam Department of Public Health and Social Services. In person, we have with us Dr. Ann Pabutsky, Territorial Epidemiologist. We also have with us Vince Campos, Surveillance Branch Director for COVID-19. At this time, I want to give the floor to Dr. Ann Pabutsky to give us a review of our last 2 years battling COVID-19. So we'll be sharing a slide. Stand by.
Ready?
Yes.
Does this work? Okay. Basically, what we decided to do was put together a 2-year summary of the pandemic from March 15th, 2020 to March 14th, 2022. And after we finished with that summary, Vince Campo is going to provide the latest trends from the past month, 28 days. Next slide. And by the way, you can get these graphs on our website, but it's nice to see it. This is hard to see with the people's pictures. Is there any way to switch that? You can basically see our 3 surges over the past 2 years. It starts there small, and then we see alpha, and then we see our nice honeymoon phase after alpha. And then Delta hits us back in August, September, continues in through November. And the last huge spike in cases, that is Omicron. Omicron hit us hard with cases. That in blue, those are the cases by date, and in orange, it's the cases by date of onset. So Omicron hit us hard in terms of cases. Next slide. This, I can barely read it. This is the number of tests conducted throughout the pandemic and the 7-day rolling average positivity rate. And you can see it looks kind of odd at the beginning because we didn't have a lot of testing supplies. And as we go through, it almost matches the testing and the positivity rate. And you can see the surges as well. Next slide. This is the 7-day rolling average of cases and positivity rates, again, throughout the pandemic, just by themselves. Next slides. You can see the surges, very apparent. This is the 7-day rolling average of cases by age group, and I'll talk a little bit more about that later, but you can see the 18 to 39 group during Delta and Omicron. Those are the highest groups. And I believe it's the 40 to 59 that were higher during the alpha phase. And I can barely see it. That's okay. We can talk. We're going to be talking about it later. Vince will have some updates as well. Next slide. And this is the hospitalizations and ICU. Now, you can see we're much worse off during alpha and delta in terms of hospitalizations and ICU. Omicron hit us hard with cases, but not as much with the ICU. But we still see, look at the hospitalization, that still was very high, but the ICU was lower. Next slide. This is the cumulative number of cases, and the cumulative death count is in orange. So the orange you'll find on the right, the total number, it's as of today, it's 343, I believe. This is, I believe, 338 up through March 15th. Next slide. And that's the cumulative numbers of the proportions vaccinated. So we're right at what? Right at 90%. And we have another, what, 47,000 people who have had COVID. So they have natural immunity and 90% of our population is vaccinated. Next slide. This is just a summary, and we're going to provide this report. I'm just going to highlight some of the things we saw because we compared the 2 years and the 3 surges, and they almost correspond exactly to the same. The first year was Alpha, second year was Delta, and the third year up to date, which is 2022, is Omicron. There was an increase in female cases from 2020 to 2021 and then 2022, and there was a decrease in cases among males. But what we found was the opposite pattern with deaths, with males, an increasing proportion of deaths from 2020 to 2021 and 2022. For the entire pandemic, the total by age, the cases were highest among 18 to 39. I know you've all heard me say this repeatedly, but the pattern has not changed. That was the, except for the recent trends, as you'll see, followed by teenagers and then 40 to 59. Now, only 10% of the cases were those 60 and older, but the majority of the deaths have occurred among those over 60 years of age. That's 2/3, 65%. Now, recently, those over 80, recently we've seen an uptick in those 80 plus who have died. They were 18.6% of the deaths to date, but the increase was among those 80 years and older. It really hit, Omicron really hit that group really hard. By ethnicity, we see the Chamorros show an increase from 2020 to 2021 and 22, but their proportion is pretty steady throughout the pandemic, and it's not anything weird. It's what we would expect to see given their numbers in the population. Filipinos had high number of cases initially, and this dropped, but during Omicron, to date in 2022, the Filipinos are disproportionate in deaths, and I think that's because they tend to be an older population compared to, say, the Chuukese, who had higher number of cases early on in the pandemic, but those have decreased, and now their proportion of deaths was high. But this is the most disparate group that we see in terms of deaths. They've had the highest disproportionately high rate of death for the entire pandemic, all 3 years. Chronic conditions, we're only seeing hypertension and current or former smoking among cases. We see the chronic conditions are mostly among the elderly. And again, I've repeated this. I know you guys are sick of hearing it. Diabetes, hypertension are the main ones, followed by cardiovascular disease, chronic renal disease, or lung disease. The proportion with diabetes has been high throughout the pandemic. It was 48.4% in 2020, 35% in 2021, and 60.9% in 2022. If you look at the overall picture of the pandemic, that's more than 50% for the average. Hypertension followed the same pattern. And although cause of death analysis is presented in the report, you can read it later, there's no real big change in what we've seen from previous reports, except for we did see in 2022 an uptick in those who had cancer as well as COVID. We did not see that earlier. We saw one or two, a few, but we did see an uptick there. And that's Omicron again. It hit the oldest old and people with cancer as well as people with other chronic conditions. And lastly, there's a continued pattern of high proportions of high school or less among the deaths. And we also were able to code the occupational and industry data from the death certificates and found that laborers, homemakers, managers, and food service workers were at higher risk for death. They really jump out. And by industry, construction, education, government service, retail, homemaking, management, and then food service also stand out as risks. And the year is just starting, but dead on arrivals represent almost 1/2 of the deaths in 2022. So Omicron really hit us hard. And proportionately, the dead on arrivals were lower in 2021 and 2020. For the whole pandemic, that average is 32%. I've already reported on that. And Crystal and everybody will make this report available. The rest is just tabular data that I'm sure you don't want to see. And Vince will now summarize the recent trends, which everybody's really interested in.
Can I get the slide? All right, everyone. So now we're going to talk about the recent COVID-19 data. So what we've been seeing over the past 28 days. So I guess we can go ahead and start on the.
That's the wrong one.
One that says 28-day trend.
It's got the,
Well, while we're talking about it, I kind of have the slides in front of me. I'll just go ahead and start talking. What we have seen in the 28 days is we are definitely seeing a drastic takedown in tests, right? Normally throughout this Omicron surge, we saw almost 2,000 to 2,800 tests. Now we see about 3,500 per week. Although we do see drastic takedowns in the tests, I can tell you that our positivity rate is not coming down as fast. And I guess we will wait for the slides come up, but our test positivity rate has actually gone down to closer to 10%. With 10%, of course, if we're testing at 3,500 tests per week, 10% of that, that's about 350 cases per week or 50 cases per day. That's still quite a bit of COVID. And if we talked about, I did put some guidelines of where we were. Okay, don't worry.
there you go.
Oh yeah, perfect. So we're, I'm just jumping into slide number 3, I guess. Yes, that one right there. Okay, so again, the blue bar chart is the tests and the orange is the test positivity. So like I said, we're reaching that 10%, but that still means about 50 cases a day or 350 a week. Now that's quite a lot, right? These are our kids, our parents, our Manumco, and we're gonna talk about more on that a little bit later. But I did want to kind of preface what we were seeing throughout the whole pandemic. So as Dr. Pobutsky was talking about, in the Delta surge at the peak, we saw 13.3% of test positivity. So we are just around 10%. So we're not out of the blue just yet. In the next slide, around the beginning of 2021, we were comfortable. We had a test positivity of 4.5%, which again is under 5%. And that was actually one of the CDC levels, right, that we were looking at, is to be under 5% test positivity. And then before Delta in July 2021, that was where we were at our lowest and our best operating, right, at 2.1%. So again, looking at that orange line, we're still somewhere in that Delta surge, right, that we were seeing in October, in that peak. So that means we're still going to see about 50 cases a day. We hope that goes down, but it's lower, but it's not exactly manageable or comfortable. All righty, so we can go to the next slide. So the next slide I wanted to show you is the cases by day. And that's exactly what we're talking about. You can see that that orange line is really our 7-day rolling average for cases. We can see that it's just slumping underneath 50, but we really want that to be less than 30 and less than 10. And of course, why do we want that? You can go ahead and see that the blue are the cases by day and gray is our cases by symptom onset, so those who are showing symptoms. But if we go to the next slide, the reason why we want to keep that 7-day rolling average really low is because if you look at our case rate per 100K over a 28-day incidence rate, and mind you, this is what is used for our CDC travel notice guide, we're still on tier 4, and it's out of a 4-tier system. So we're very high. We definitely want to go down to high and then down to moderate, and then of course we want to be at low, which is where we want to operate. And we can go ahead and move on to after that. But it's not all bad news. We're making great strides, but we're just not exactly there yet. If you look at our case rates for Guam, which is in blue, and you look at Hawaii's case rates, which is in orange. Now, if you do see that slight dip, that's because they actually changed their reporting methods from daily to weekly. So there's a little bit of a data trick there. But you can see that we are doing below Hawaii, and even above that, we're actually doing under the United States, which is the gray, right? That's the average case rates for 100K. So we are doing good. So now the next one that I wanted to talk about in the next slide is actually looking at these age groups in particular. As Dr. Pobutsky said before, the 18 to the 39 age group really drove a lot of the cases. And of course, that's not ideal, but it's something that we can work with, right? 18 to 39-year-olds, they are our strongest. They have the strongest immune system, and they take well to the vaccines, correct? But at the end of this graph here, you can start to see, and I know this might be a little hard to see, but that green line there, that is what we are worried about as we moved out of this surge. We can hit the next slide. I highlighted a little bit. There you go. That green line there is our 75 and older age group. Right? From the beginning of the pandemic, we have been trying to protect our vulnerable population, and looking as we move out of the surge, they're definitely coming back up. And it doesn't make sense. It does, because when we started the vaccination, they were the first to be vaccinated. And that means they're also the first to be boosted. They're first eligible for booster, but they're also still necessarily frail, and they are still vulnerable. And so this is a little alarming to see that they have now gone above the case rates of the 18 to 39-year-olds, right? And it's not as normal as we would see with all the other age groups. As you can see, they are slumping down. And of course, we normally see the 18 to 39s being on top, but that is very alarming to us, knowing that our Manumco are starting to catch more COVID as we move out of a surge, not necessarily as we move into the surge. Okay, we can go to our next one. Our next one is just our hospitals. So again, just wanted to highlight that we are seeing, I guess you could call it a converging hospital census. So it really looks like at the end of this graph, we're seeing about 15 to 20 over the week. I believe the average was about 16, 17. And if we go to the next slide, that's actually about 6% of the people in our hospitals. So just COVID only, 6% of them are, or 6% of our hospitals are COVID patients, right? And that's definitely something that we are looking to work with, especially when we look at those triggers for the community transmission. That is definitely underneath that 10%, which is what we want to be.
Yeah.
Right. And then just for the last slide, just, we always talk about symptomatic and asymptomatic. We're definitely seeing a half-half. We're seeing 50-50. And of course, that's something that we want to look into. We can definitely catch the symptomatics, correct? Right? If you're symptomatic, go get tested. Now, if you're asymptomatic, that's what we're really trying to push for, is to get screening, right? Screening, testing, and, just generally checking if you are infectious or not. But otherwise, that's where we are within the last 28 days. And again, like I just wanted to say, we're not out of the woods just yet, right? Something that we have learned is that COVID really loves the holidays, and we are a very holiday loving community. Our next biggest holiday is Easter. And so we don't want to get too comfortable, because that, as we've seen, the time between the Delta surge and the Omicron surge was about 2 to 3 weeks. And we really want to hinder that so that we do not see another surge, just as we're coming out of another one, right?
Yeah.
And that's about it for me.
Thank you so much. That's Vince Campo again. He's the Surveillance Branch Director for COVID-19. And prior to him was Dr. Ann Pabutsky, our Territorial Epidemiologist. I also wanted to introduce Dr. Annette David, another epidemiologist who's also joining us virtually and will be part of our panel in a short while. But in the meantime, I do want to give the floor now to Governor Lou Leon Guerrero for her remarks.
Thank you very much, Crystal. Dr. Ann and Vince, thank you so much for those data. It really brings, I think, to light exactly where we are today, where we've gone. And maybe we can make some kind of logical guess and where we might be in the next 4 weeks, next 2 months. I just would like to take this opportunity to talk to you, the people of Guam, about the executive order that I issued last night. I have extended the public health emergency for another 30 days. We are extending for many reasons, but most importantly, to protect the people of Guam, and protect our collective progress, and protect our ability to proceed into recovery without abruptly cutting off the services that we as a community have come to rely on throughout the pandemic. On this day in 2020, we were 2 weeks into the pandemic. We watched the world rapidly evolve, board up and brace for the spread of the coronavirus within their communities. I'll never forget the moment FEMA showed us those first projections. and I am sure you remember it too. They said that Guam could lose 3,000 lives. As a nurse, I knew the most vulnerable members of our community were most at risk. Our grandparents, our my uncle, our loved ones who have comorbidities like diabetes, asthma, and hypertension. I thought about the limited healthcare resources we have on the island. I knew we had to act fast. You might recall that we entered a state of public health emergency shortly before the first cases of COVID-19 arrived at our shores. Since then, lives have been lost, but many more have been saved because we took quick and decisive action. Declaring a public health emergency allows our island to receive critical resources for preventative and responsive actions. It continues to build and strengthen our ability to effectively address a range of health threats, including infectious diseases. I was a member of the 26th Guam legislature that passed the Emergency Health Powers Act. And I can tell you, at that time, none of us could have anticipated the full scope of the pandemic response it called for. I am the first governor who has had the duty to fully implement this Emergency Health Protection Act. It has provided our island the tools we need to contain the virus. It has provided us with the mechanism to take actions rooted in law, guided by democracy, and implemented by a coordinated team of experts, planners, and medical personnel. Maintaining the public health emergency is not a personal choice, but a reflection of the reality of our situation. Ending the public health emergency without an organized transition plan would only hurt our island and put our people in harm's way. It would mean a cease to the stream of resources that have helped us prepare for, withstand, and recover from the pandemic. It means that technical assistance, critical funding, and manpower capability we have to come to rely on goes away. We would stand to lose over $2 million a month in SNAP allotments that ensured local food stability when many were furloughed or lost their jobs. Today, emergency allotments affect over 15,000 households on our island. We also would lose resources that support individuals and families, businesses and industries, and the delicate recovery of our entire island. Because of the resources granted to our island during this state of emergency and through the tireless work of frontline responders and our entire community, we braved the worst and beat the odds. 2 years later, we are recovering, but we are still in a state of emergency. Closing our eyes to this reality will not make it any less true. I want to make it very clear. Lifting restrictions is not the same as ending the public health emergency. Our progress has meant schools stay open, businesses can rebuild, and social gatherings and larger public events can resume. We are balancing our road to recovery with our continued emergency responses. We must continue to address the lingering health needs of our people. We cannot and will not simply decide to end the emergency because we are tired, because we have false confidence. This is not who we are as a people. As a result of Guam's sustained emergency status, we are able to continue providing vaccines, boosters, and treatments for everyone, especially the most at risk. We are carrying our community through the lingering and unknown effects of this pandemic, and we absolutely must protect our hospital to do so. While others may consider a reckless abandonment of the life-preserving resources in play, I refuse to put the people of Guam in harm's way. I will continue to make methodical, data-driven decisions that optimize our emergency capabilities, protect public assistance, and secure our path forward. Recently, the CDC announced new metrics that monitor the transmission of COVID-19 using community-level factors that focus on reducing medically significant illness and minimizing strain on local healthcare systems. The CDC community-level metrics are intended to inform community actions and policy decisions, including implementation and easing of restrictions. Based on these metrics, Guam's level of risk is anticipated to be medium this week and may move to a low-level risk soon after. As part of our phased-in approach to adjusting restrictions based on data, it is appropriate at this time to consider the final remaining category of community restrictions, the mask mandate. Our community has embraced the use of masks. We wear them even when it is inconvenient or uncomfortable. We have accepted masks as a small price to pay to protect our health, our loved ones, and the health of our community. With the CDC metrics and corresponding guidance for easing of restrictions, we have an objective lens through which we can consider our local factors and fashion a reasonable framework for our continued response to the pandemic. This ensures that our decisions are guided by science and not emotion or fatigue. To the people of Guam, I thank you for your continued support and strength. Because of you, we are safely returning to normalcy and rebuilding our lives. It will get better. Undankulu na Sizus Masi. And now we'll open for questions.
Yes, Governor, thank you so much. Joe Titano, Pacific Daily News.
Morning, Governor. Morning, everybody. Good to see you in
Wait,
person.
it's afternoon. Joe.
Afternoon. Good afternoon. Governor, one question. I know in the executive order issued last night, it does state that I think something like 30 states have removed their public health emergency, but it notes that they were able to put you mentioned an off-ramp into law with the help of the legislature. I guess, what are some of those policy needs that we would need at this point, to work with the legislature in order to move out of the emergency status?
Well, that is right, that some states have lifted their emergencies, but they did work with their legislature to put in some of the policies permanently. Like, for example, for me, I'm thinking maybe we need to do something around human resources. Because one of the things in a health emergency is that we are authorized to waive licenses. We are authorized to move personnel from one agency to another. But policies that can maybe drive phase-in situations in lifting restrictions and lifting the emergency and not just abruptly closing it off. Joe, we have through these 2.5 years have established a very, I think, effective machinery to respond to our pandemic. We have mobilized multi-agencies to work together to respond quickly to situations as they occur. And you saw Dr. Ann, where we had a surge, and then we were really fine for a few months, a surge, and then we were fine for 1 or 2 months, and then a big surge. You know, we have to stay in this public health emergency in order for us to act quickly. The other thing is, you know, maybe policies that provide financial funding for situations when we do need to get those resources. So maybe phased in funding mechanism to be able to get those resources. Many things that I think we need to look at that can be made as policies to help address us to transition into a very reasonable lifting of the health emergency.
Right. And so I guess moving forward, does there need to be more collaboration with the local legislature to kind of build that off ramp as you see it?
Of course.
And one other question. I know the decision to lift mask mandates is tied to low status, but the CDC doesn't recommend mask mandates for everyone at medium. Why are we sticking with the low status?
Because if we are in a low status, then we are much more making sure that we are protecting our community. Because if you're just in a moderate, you know, you still have the risk of going into high risk. And for me and for our team, in order for us to feel comfortable that we are keeping our community safe, we have decided that if we are in the low status, that means your risk of exposure, your risk of infection, your risk of getting sick is very, very low. And that's why we are very conservative in that. We want to make sure, Joe, I mean, we are in a very fragile situation here with our healthcare delivery system. And that's why we can't risk just putting it in moderate throughout the whole period. Other states may do so, but they also have other hospitals and other healthcare accessibility that they can use should we go into another surge, or should we be in a situation where put stress and overwhelming our hospital. Yeah.
And you mentioned the funding, the federal funding for the National Guard is going to run out in July. What exactly is what would be the trigger for that?
Well, we've been getting extensions for the funding for the National Guard. That's really triggered, I think, if we keep on in their state of health emergency, we have a better case to make with actually it's the president and Congress that does that. We make a better case that, hey, we still need the services of our National Guard to help with vaccination, to help with treatment, with surveillance, you know, those kinds of very essential measures that we need to do to respond to the pandemic.
Understood. Thank you for that, Anna.
Lou Leon Guerrero, you're next.
Hi, Governor.
Hi, Phil.
I did want to ask a question about the determination of that low risk level. It was reported by the Joint Information Center in its daily release yesterday that our risk level was moderate. About an hour later in the executive order, it was reported out that our risk level was high.
Right.
Today, you're reporting it's moderate and that it can go down to low in a few weeks. Because the risk level vacillates, I'm trying to understand when you start the first 14-day trigger in the executive order to start to do away with those pandemic restrictions, should our risk level elevate to moderate or high after that? Are we going to turn back the process, or once it starts, we're going 28 days later, not going to have masks anymore?
Okay, so you're right, the risk level fluctuates, and that's why we don't make our decisions on the daily monitoring of those risk levels. We're making our decisions based on the weekly calculations of those indicators, right? To account for those fluctuations. And also, after we are given a certification for its public health responsibility, because they are the experts, once they feel through data, right, that we are, you know, in a safe environment, they will issue to me a certification saying we are now in a low risk level. And then from there is where 14 days after that. And the reason we do 14 days from the declaration is just exactly that, the fluctuations. And so over time, we feel those fluctuations will probably stabilize, right? And then based on the data and information, we will then proceed. Yeah.
So if within the first 14-day period, there's a surge, is there a possibility that the mask mandate, which follows a second 14-day period, would not proceed?
Yes, that is a possibility. But again, we are looking at data not just on that day, but if we continue to see a surge for 14 days, yes, that is alarming.
And what about a surge following the lifting of all of the restrictions? Would that, in your
Yes,
mind, trigger?
It's the same that we did when we were fine, right? Or we were really low from Delta. And then we saw the surge right away. We were at a point then, Phil, to kind of like just open the whole island, but we didn't because we saw the surge. And we wanted to, again, focus on the protection and saving the lives of our people. And that's when we went back into imposing more restrictions, but we weren't as restrictive as we were in the Alpha and the Delta. And that is because we had vaccinations. And that is because we had advanced treatments. So we had tools to help our people go through their illnesses.
So, and that's why I'm trying to understand if increase in cases following a relaxing of restrictions is expected. Should the public expect a reinstatement of restrictions like social gathering limits
Yes,
or mask
absolutely.
mandates?
Yes,
Okay, thank you, Governor.
it's the most prudent, reasonable way to protect and to go back. I'm hoping that we don't. You know, Phil, I'm really hoping, and I'm watching the world too. Remember, this is a global pandemic. And what happens out there in the world affects us. Why? Because they travel. And so I'm watching them. For example, in Europe, you see it's starting to surge. And the reason for that, they're thinking, is because they prematurely lifted restrictions. I don't think we'll see that with us because we've been very methodical, very strategic, and very data-driven in lifting our restrictions.
Thank you, Phil. We'll come back to you. Maureen Maritita.
Buenas, Governor. Good afternoon, everybody. Are you with me, ma'am?
Yes.
Okay.
Yeah.
Okay. I understand that if we do have surges, we're going to take steps back, which is, I think, what you're saying. But it's not going to be a case of just affecting the local population anymore. Once we encourage visitors from Korea and Japan, if we yo-yo in and out of restrictions, it's going to affect tourism. So is that something you're going to bear in mind rather than just the indicators over 2 weeks periods?
Yeah, we will consider that. And if you go back also, Maureen, and you look at, I think it was the Delta, and then we kind of like went down and we started, some of the countries were starting to look at lifting their restrictions, but they also pushed back and made more restrictions, right? So yes, all of that is going to be considered, but the most overlying, overwhelming consideration that I'm going to make is how is this going to affect our healthcare delivery system? How is this going to affect our, our people's course in its infection exposure, and how do we move forward to making sure that our businesses continue to work, our people continue to work, which is what really happened even in the Omicron. I did not shut down businesses. We kept businesses open. And why is that? Because again, we had vaccination and treatment. I felt that people had the means to get treated and to decrease the severity of their illness and wouldn't be asked risky in their severity. So, we do look at all and consider all factors.
Okay, thank you. So
I just wanted to say also, Maureen, like I said earlier, our team is made out of multi-agencies. And I also work closely with the Chamber of Commerce. I work closely with the business people. I work closely with GVB. So we're not making these decisions arbitrarily and capriciously. We are not. We are not making it. And they are not draconian measures either. They are measures that have proven to save lives. So I just want to assure the people that our work and our responses and our actions are very deliberate. They're very well thought of, and they are input from various experts, from doctors, nurses, public health people, business community. So, I have the fortune that there's great cooperation, Maureen, in the community to fight this virus. Yeah. Just want to make sure the people know that, so that they're assured that our actions are not arbitrary or they're not capricious.
okay, well noted, ma'am. So for my second question, so assuming everything goes well and we move forward and we lose the mask mandate and our numbers stay low, where do you see us after that? Will we continue to keep a supply of I guess you could say pills, preventative medicine for people who do contract
Yes.
COVID?
Yes, that's been a discussion in our team. What I see is that I think within a month, maybe 2 months, that we will probably lift everything. Again, based on what the circumstances are, the data, and so forth. In that discussion, we did talk about continuing vaccinations, continuing boosting, continuing treatment, and continuing surveillance and contact tracing. That's very key. Continuing to test people. So if we are starting to see things, then we will, act accordingly. Now, Dr. Ann is going to be monitoring wastewater, because wastewater is another sort of early indication of where we're at in terms of the virus. Fernando and his team and Dr. Bach and public health are going to continue the operations of the contact tracing, surveillance. We are going to morph our Operation Homebound into a community outreach program. Fernando is going to make sure that we have supplies of medications and vaccines, and we're going to continue this. We'll probably continue it for the next 2 years. Serious, because we want to make sure that as the experts and the, you know, the leaders in protecting our people, that we do our due diligence and we do our thinking ahead to make sure that our people continue to be protected.
Okay.
Thank you, Lori. We'll come back to you. Nestor
right.
Lacanto?
Thanks, Chris, and half a day, everyone. Governor, if you don't mind, I kind of want to shift this conversation to the politics of the situation. Your executive order criticizes in great length Senator Duenas and the Republicans' resolution that will be heard tonight. And it calls for terminating the public health emergency. And in fact, Speaker Terlahi, in her response to you and co-signing the executive order, was a bit critical, saying that, among other things, that it was political, unnecessary, and a distraction. Why did you feel the need to include those whereas clauses in the EO?
I felt, Nestor, that I needed to include it to educate our community about what the consequences are for this Resolution 291. Because if you read the resolution, I don't see any justification like we have to continue it, to continue public health emergency. I don't see any justifications to end the public health emergency. I don't see anything in their resolution that says, oh, we understand that as a result of this public health emergency ending, that we need to provide $2.3 million a month for those recipients of SNAP. I don't see that in their resolution. So as a responsible governor, I wanted to educate the people of Guam about the consequences of this action if it is passed. Because I'll tell you, if it is passed according to law, I cannot override it. These are senators, Nestor, that are really edging into the territory of medicine, healthcare, and medical. If they pass this law, and as a result of that, we don't have any more FEMA assistance. As a result of that, all the medical people that are helping our hospitals have to go home because we don't have the means to pay for them. Right now we do, through public assistance and FEMA, as long as we are in a state of emergency. So when you go in declaring no longer a state of emergency, you have to think of all of this, and you have to provide for all of this. You have to make sure that there is personnel there that can respond like that if we should have a surge. You guys saw the surge from the Delta and how Omicron just went up like this. You also saw that in Delta, more of the deaths occurred. You saw that when we saw all these dead on arrival people, and we were able to target where the vulnerable population is, that we had the personnel to go out there and respond to that. Are those senators willing to risk the lives of our people by declaring non-emergency abruptly? That's my question. That's why, in my authority, I wanted to educate our people of the consequences of their actions. If I did not, I am not doing my duty as a governor.
Thank you so much, Nestor. Polly Stuba, PBS?
Wait, don't I get one more, Chris?
Sorry,
just-
yes, one more. I think that was just one question. Yes, one more question.
Yeah, thanks. So just to follow up on that, Governor, Senator Dueñas was on our air this morning, and he called some of your decisions overly divisive. For example, he's said that we've reached a point where adults should be able to decide for themselves if they want to wear a mask or not. What is your response to that? And how much of an election issue do you think the public health emergency, the mask mandate, and your handling of the pandemic response will be?
Are you saying that I'm doing this because of election? Is that your question, Nestor?
No, I'm asking, do you think that your handling of the pandemic response will be a major election issue?
I think the election is going to, the issue of the pandemic, yes, is going to be a topic. Absolutely. What have we been living in the last 2.5 years? If I said it wasn't going to be, I don't think that's correct. I think pandemic is going to be used as an issue. Now, the other one that you were saying that Senator Dueñas was saying it's divisive and that adults should have the choice not to wear a mask or not. I think adults should really think very seriously about if they don't wear their mask, how is that going to affect their children that are not able to have the vaccines? How are you going to protect transmission, right? So I don't think so much as it's an individual choice, it's an individual responsibility to do what you think is right to protect transmissions and infection of your loved ones and yourself.
All right, thank you, Governor.
I also just want to make a point. The actions of the senators on this resolution, they should think about that in their election. Because people are going to ask them. They're going to ask them. And, if they're thinking it's individual choice, individual rights being forced to stay in the homes, that's in the beginning when we didn't have any vaccines and we didn't know what was going on with the virus. So, yes, the pandemic, Nestor, is going to be, I think, a topic. If it's not, I'd be very surprised. But people will watch them also and see how they vote on this resolution. Because this is now putting people's lives in jeopardy. Yeah, I'm serious about that. No doubt about it. Pull it.
Confident Governor. I think you just answered the question that I was going to ask as far as the argument with the legislature on this resolution is that this resolution would not prevent you from signing another emergency declaration, but rather you would work with the legislature. They would get a majority to extend it or reject it. How problematic is that situation, or not problematic at all?
The problem with that argument is that they don't have an understanding of the complicated processes that we have to go through to again get all those resources back, right? That's the problem. It'll take time. And when you are in an emergency and you're fearing for people's life, time is very valuable. That's why I'll tell you, Polly, when these first three coronavirus came into on March, I think it was March 15 that we found out about it. That was the worst day of my life. Because I knew as a nurse that now the virus has come in, and now we are faced with some very hard challenges in protecting our people. And that's why I make that hard decision. And the senators and the sponsors of this resolution think that I did it capriciously and arbitrarily. And that I use my authority, I forget what the word they use, but that I abuse, that's what it is. They abuse. They are claiming that I am abusing my authority. And Senator Terlai was concerned that I was using an executive order medium for politics. I was not. I was not. I am using, as I am authorized to do, this executive order to explain why I think we should have another 30 days of public health emergency. And to explain the consequences of not continuing on with the public health emergency. I make the argument that the senators, they do not have justifiable reason to lift the public health emergency, and that they are doing it for politics and headlines.
I wanted to transition also back to the mask mandate, because even the latest EO only talks about 14 days after the community level metrics for removing the mask mandate outdoors. When you said you're willing to lift everything in 2 months, that would include masks indoors?
Yes. So if you read the public health, the executive order, it gives timeframes, right? So say next week, Friday, say this whole week, we are in low, right? And the weekly calculation makes public health confident that we are in low risk. And they certify to me, Governor, we are in low risk status, and I accept that certification. From that date on, 14 days, because I want to make sure, then outdoor mask is lifted. If we continue in low risk, 14 days after that, indoor mask is lifted, and then we won't have any social distancing. So you could say in a month, maybe 2 months, yeah.
I'll wait for the next round. Thank you, Governor.
Thank you, Polly. Troy Torres, Candid News.
Hi, buenas, Governor. There was in your executive order, you talked about how, I'm going to paraphrase here, how an abrupt end to the emergency, the public health emergency will not be good for several different issues. It was even brought up the supplemental food stamps, but how, and if you could talk about this more, Governor, you said, in comparing this to other states where their legislatures did end the public health emergency, those legislatures actually put into place statutes that sort of gave the end of a public health emergency a soft landing by sort of facilitating things. Could you go into that a little bit more?
Yeah, I'm thinking more about phasing it in, right? And I'm thinking more like, I think Phil was asking the same thing. I'm thinking more providing funding sources so that if we need to continue on, say, with travel nurses, because we need those travel nurses, then, they can give us a budget, increase the budget for the hospital so that they can continue on with the travel nurses. Facing in maybe more testing supplies, just things like that is what I was thinking in terms of not just today, cut it off, and then what do we do? You know, and like I said, are they willing to give us, you know, 2.3 million every month so we can continue on with the increased allotment of SNAP for our people? Are they willing to write legislation that says, you know, if we see a surge, the governor can hire people and transfer people without any, I don't know, reporting or anything like that. Some policies that we can say is permanent.
Thank you, Governor. My second question is it's related to the first. I did find the whereas clauses pretty educational. I didn't know that the supplemental food stamps program would be affected the way it was written in the executive order. And so my question is, I mean, it's sort of a two-part. Why didn't your office release this educational information to the public sooner? And secondly, is this information that your office and the legislature can be collaborating on in the future so that this type of legislation or future legislation can be enacted and there can be a collaboration?
So your question is, why didn't we put forward this education sooner than now, right? That's your question.
That's the first part of my question, yes.
You're right. Because we were still in a state of emergency, and there wasn't a situation where this kind of funding would be jeopardized. The people of Guam knew about this SNAP, and they knew that it was a federally funded grant. So I didn't really, you know, I never really thought about we should educate all these people all at once and say, if you stop the public health emergency, we'll lose this. There wasn't that trigger to get the education out. That's the best that I can explain that. But because now there is the danger of prematurely lifting the public health emergency, I felt the people needed to know what the consequences are. Secondly, I didn't know anything ahead of time, Troy, about this resolution till it was introduced. I never got a call from Senator Chris Duenas or Senator Joanne Brown or Senator Tello Taitagui or Senator Jim Moylan or Senator Tony Ada. You know, Senator Jim Moylan writes me a letter almost every day. But he never wrote me to say, hey, heads up, Governor, we're going to lift the public health emergency. I was never approached. I don't know if public health was. Were you guys ever approached? No. It seemed like, you know, Senator Chris Duenas woke up one day and just said, I think we're ready to lift the public health emergency. And on what basis? On what conditions? On what science and what data are you using, Senator? Because the lives of the people here are at stake. No joke. No politics here. That's real.
Thank you, Troy. Aurora Khan, Pacific Island Times.
Hello, good afternoon, Governor. I just have a question regarding the termination of the public health emergency. So you did mention in your executive order that there would be a need for us to be at low risk before you would consider removing the mask mandate and so forth and so on. So my question is, in relation to that, if we ever arrived at the point where the mask mandate would be fully lifted, would that signal the termination of the public health emergency?
You raise a good point. You don't really, I think there is a confusion here about public health emergency and lifting risks, and lifting restrictions. You don't have to be out of a public health emergency to lift restrictions. You've seen it. We've been in a public health emergency and we've slowly lifted restrictions. After we fully open, there are other things that I would consider. I would first like to see what World Health Organization says, because I would first like to see what the Human Health Services say. These are your officials. World Health Organization, as you know, looks at the whole world in terms of diseases, pandemics, and so forth. I think the Health and Human Services, as I understand it, says that if they are going to lift the emergency, they will give 60 days notice to lift the emergency. Why is that? They understand the consequences. These are your medical experts, your public health experts that we rely on for information and guidance. So even though 2 months we lifted, I would like to see what Health and Human Services, CDC, and World Health Organization will say.
Thank you, Governor. Can I just follow up on that? So in your view, what would be the requisites or prerequisites for terminating the public health emergency?
What would be the prerequisites? One, of course, would be how we are in a few months in terms of where our risk exposure and our risk level is. Two is I want to make sure that we have the capacity, we have the supplies, we have the processes, we have the operations in place and ready to go should there be a surge. I want to make sure about that. I want to make sure that we have the proper capacity and capabilities and human resources that the hospital needs in order to respond and manage another surge. There are a lot of considerations to make. I would like to know how Asia is doing, because they come over and they're a source of bringing in infections, just the same as the United States, throughout the whole world. Because we will be having international travel and domestic travel here too. So it's just not a clear-cut black and white thing. There are a lot of considerations to consider.
Thank you, Governor. Can I just have one more question, please?
We're gonna actually go to the last person in the first round. Tony
Can
Lamar.
I just add something to, it's also Oya, right? Is it Oya?
No, this is Aurora.
Oh, Aurora. I just want to also say that there are services that I would like to continue on that maybe can only be continued on if you remain in a public health emergency situation. One of them is SNAP. And many states have kept their public health emergency status because of the SNAP program.
Thank you, Governor.
Thank you, Aurora. Last but not least, Tony Lamarana, KFC7 PNC.
Half a day, Governor. Have you looked at developing an endemic plan? I know the governor of California, Governor Newsom, unveiled his endemic policy, which actually prepares the state for any increase in COVID vaccinations. Part of his plan is to stockpile 75 million masks, ramping up 200,000 vaccines, 500,000 tests a day. So he's although he's developing an endemic plan, in the plan is also the resources necessary to counter any increases and possibly surges. The thing is, it provides some continuity and consistency, and most especially for the economy. Businesses will have a better understanding of, as we move into various phases, they have a better understanding of what direction, new guidelines are going to take place. So have you looked at developing an endemic policy for Guam?
We are. Earlier I mentioned about, when we go into the endemic, we want to make sure that we have the supplies necessary. We want to make sure that contact tracing operations is still in place. We want to make sure that there's a division in the public health, social services that can respond rapidly should we start seeing a surge. We want to make sure that we can mobilize people again. We want to make sure that the hospital has the capacity. Those are all part of the endemic plan. The endemic plan also includes testing. It includes surveillance. It includes monitoring. Those are all going to continue. Because we need to be on top of this should we start seeing any other challenges. And it might not be COVID, it might be another infectious disease that we don't know about. But I'll tell you this, Tony, going through this 2.5 years, we're prepared.
So when do you anticipate coming up with this endemic policy? Again, because at least it provides a clear picture to the economy, people in the community on what steps and procedures in case we get any new surges in the future. As we plan the return of tourism, to automatically cut things off. Businesses would like to know: is there going to be a gradual? Are restrictions going to be gradually be imposed or that type of thing? It just provides, less uncertainty within the community.
Right. So if you look at our history in dealing with this pandemic, we have gradually imposed restrictions. I remember we went from 500 social gathering to 250 to 150 to 75. So yes, we are going to be gradually doing, but there may be the situation that gradual isn't the choice. That it may be, hey, you guys, we need to do this quickly and we need to do it as soon as possible. Anyway, maybe Fernando can talk more about what the plans are to continuously monitor those public health services, Tony. That is public health's responsibility, and they are going to continue those to safeguard. That's public health continuously monitors infectious diseases. They do. There is an ongoing infectious disease division. That's how we found out about dengue fever. That's how we found out about this corona. I remember them telling me in December 2019, Governor, we're tracking something happening in Wuhan. Governor, we're tracking something happening in China. Governor, we're tracking something happening with the US.
And Governor Chima Bakum would like to also respond to
Chima
this
can talk
question.
about that? Okay, Chima's on the Zoom. Chima, you can chime in.
Yes, ma'am. Thank you very much. I think in response to your question, if the disease becomes endemic, and like the governor stated, it becomes a public health responsibility to continuously track the disease like we track other diseases. And in the division, or in the Department of Public Health, we have the Bureau for Communicable Disease Control that actually oversees all communicable disease on the island. And we're also setting up the Bureau of Emerging Infectious Diseases that also has the components to actually address emerging and re-emerging diseases. So to answer your question in a short form, public health responsibility for endemic diseases will continue immediately the pandemic is called off. Thank you.
Right. And then, well, again, I just want to know, is there going to be a endemic plan in black and white? So, you know, one, you know, there's a manual, not also for the health professionals, but for the community as well. I mean, you look at California's endemic policy that they've put together. Again, it does stockpile all the necessary emergency supplies needed, but it's a plan. It's not, you know, moving from week to week, you know, granted, you still have the authority in case the surge, you know, gets blown out of proportion, but you know, people just want to see, and most especially people who in the economy, people who are employed, they want to see exactly how, is there going to be a gradual move of using the plan as the template moving forward?
So the question should be, are you talking about a pandemic plan or an endemic plan? I don't think there's an endemic plan anywhere for a disease that is endemic.
You need to read then, Doctor, you need to read Governor Newsom's endemic policy from California.
Okay, Fernando, I think wants to also.
Yeah, half a day, Tony. So part of my responsibility as the incident commander is, as we are in response mode and transitioning to recovery, it's almost like you know, handing the football off to public health, right? And what endemic and what Chimo was trying to express is that part of the endemic plan is, what does COVID look like within public health in a steady and organic state? And what I mean by organic is, how is it managed with just public health alone, right? Removing all the external assets. That plan is in development as we come down. If I'm kind of understanding what you're getting at with the question is you want a plan that people can look at and they can count on. But
Yeah,
the truth is, if anything we learn is that the virus ultimately dictates. We can say right now that, yeah, we absolutely want to have a phased ramp up and we want to have a phased ramp down. But the truth is, if we have a virus that comes or a variant that comes that's much more transmissive or severe, that changes the entire landscape, as you saw with Delta or Omicron, where Delta was more sort of severe than Omicron, but Omicron was more transmissible and it presents different problem sets. So yes, there will be guidance that comes out. We are stockpiling on certain resources, and this is really where it comes into play that I think partnership with the legislature is going to be critical, because there are some things that we can work internally through grants, through assistance with FEMA, or kind of a long-term strategy, but there are limitations to those, such as long-term facilities, long-term leases that require participation from the legislature.
And again, you know, Fernando, if you read Governor Newsom's policy, it doesn't put aside preparation. I mean, he talks about stockpiling. He talks about keeping a registry of corporations and companies that will assist in case they get another surge. So they are prepared. I mean, the policy prepares them for a surge, but it also, you know, allows them to, you know, get back to normal living with the pandemic. Korea, for example, they've adopted an endemic policy as well, even though they're still having surges, but they've gotten to the mindset that we need to live with this virus. And, you know.
Excuse me, Tony. Dr. Annette David would like to comment on the California plan. She's ready to respond to your inquiry.
Doc, I'll go after you. Thank you.
Are you talking about Governor Newsom's